Hello, everyone. Welcome and good afternoon. Good afternoon, everyone. Hello, hello. Let's make sure the captions are working. Okay, perfect. Can everyone see me? Can everyone hear the interpreter? Just want to check in. Okay, great. We're ready to get started. I am thrilled to be here. For anyone who I have not had the pleasure to meet, my name is Dr. Tiffany Panko. This is my sign name, and I'm the Executive Director for the Deaf Healthcare and Biomedical Sciences Hub, Deaf Hub. My team in the Deaf Hub works together to run several different programs that promote representation of deaf and hard of hearing people in the healthcare and biomedical science career sectors, including hosting educational programs such as this one. I'm thrilled to welcome you all today to Deaf Hub Vital Signs. This is a lecture series where we showcase a healthcare professional who shares their experience in navigating the healthcare industry as a deaf or hard of hearing provider who is either BIPOC and/or a woman. We recognize that the underrepresentation of those who are BIPOC or women is compounded on top of being deaf and hard of hearing, and so it's important to elevate their stories. And that's the goal of this presentation series. It's my honor to be here this afternoon to introduce you to Dr. Tiffany Bridgett. This is her sign name, which is different than mine. Dr. Bridgett is a deaf licensed clinical psychologist in Massachusetts and the founder of Lifestyle and Access, PLLC, where she provides accessible, culturally responsive mental health care for deaf individuals and hearing clients who are impacted by complex trauma, serious mental illness, and systematic barriers to care. With over a decade of experience across hospital, school, and community settings, Dr. Bridgett uses a trauma-informed, relational, and collaborative approach. As a neurodivergent psychologist herself, Dr. Bridgett brings empathy and authenticity to her work. And she also trains mental health interpreters nationwide in trauma-informed practice, ethics, and cross-cultural collaboration. Please join me in giving a warm welcome to Tiffany. Thank you. Thank you so much. Thank you everyone for coming and having me here. I'm very proud to be back because I am a graduate of RIT myself. It's very nice to be home again. I'm Tiffany. I'm a licensed clinical psychologist. And my hope today is to share about my life experiences, the barriers that I've faced, and how I've navigated them, overcame them, and found my purpose. I'll talk about advocacy, care, and change. I'll talk about my experiences growing up, and then I'll talk more about my work experiences and how I got to where I am today. Feel free to ask questions during the presentation, no problem. If you do have a question, please raise your hand and wait just a moment for the deaf interpreter to come on stage. Okay? This is what I'll talk about. Like I said, I'll start with an introduction about myself. I'll talk about my life journey and my childhood. And then I'll share some examples of systematic barriers that I've faced and how I've navigated those challenges. It's hard to fit everything into just 1 hour, so I'll touch on a number of different topics. But if you'd like to talk about anything further, feel free to come up to me during the reception and I'm happy to share more. Okay? All right, these are different parts of me and who I am. All of these pictures are me. So this shows my personality outside of work and then also at work. and then finally as a mother myself. I want you all to see that I'm not just a psychologist. I have many different identities. And that influences and shapes the type of psychologist that I am. At the beginning of my journey to becoming a psychologist, I did often have frustrations as a deaf person. There were barriers that I faced and I wanted to change the system. But I realized over time that there are some things I can change and some things I cannot change. And what's helped me a lot is to be able to identify the difference. I can focus my energy on what I can change instead of spending time and energy and frustration on things that I just can't change. That is a hard skill to learn. But it's important to know where to invest your time and energy in advocacy. That's something that I learned over time. That's not something that I learned early on. But it's a realization that has really stuck with me. And since realizing that, it's made it easier for me to focus on the advocacy that's really important. So keep that in mind yourselves too. So before I forget, I wanted to share that I'm not the only one on stage presenting today. I am also pregnant. So it's really both of us here on stage in front of all of you giving this presentation today. I just wanted you to know, in case you're wondering, that the answer is yes, I am pregnant. I'll share a few different parts of my life journey, from early childhood to my school years, including high school, and then college, graduate school, after graduating, then becoming an independent licensed psychologist, and through each of these stages. And I have lots of pictures along the way too. So my life story is that I was born to hearing parents. I have a deaf brother, but I was the first deaf person in my family. I am not from a healthy home environment. I had a hard life growing up, and my household was very abusive. I was culturally oppressed by my hearing family and told that I needed to stop signing and use spoken language only. That has really stuck with me. From then, and then now as a psychologist, looking back on that. That shaped my life experiences, and it really makes me value what I do today. That's something to keep in mind, because that's why I care so much about people who are marginalized, is because I was that person who was marginalized. I went through trauma. I was that person who struggled to get help. The woman in the picture is a teacher who actually came to my house and taught my family sign language, and taught my brother and I sign language. That was very special, and a very positive part of my childhood is that I did have access to sign language. Where many deaf children and hearing families do not, I did, and I'm very lucky. But that person made a huge difference in my life. Even though I have a hearing family, I do have a deaf brother, so we were able to have conversations and use sign language with each other at home, and I was not alone. I think without my deaf brother, I would have struggled much more when I was growing up. You can see the bottom picture is me on a bus. I went to a mainstream school, and then later I went to a deaf school when I was around 4th grade, and my deaf brother went to the deaf school starting around 1st grade. We had a 3-hour-long commute, so we stayed in the dorm during the week, and then we went home on the weekends and back to school on Sundays. That commute time was very long, but that was what was needed for me to have access to education. So I think that paints a picture of my early childhood. Here are a few more pictures. First is my father. My father and I are very close. He knows sign language. We can communicate in sign language. He never saw me as being any different because I'm deaf. He always advocated for me, and part of the reason for that is because he's a medical provider, so he saw things differently. Another picture is of my mother. We do not have a relationship anymore. I am not close with her. She was abusive to me growing up. And when I was growing up, my father was a single father. And then the picture in the bottom right is my grandmother, who I absolutely love because even though she's hearing, she forced my family and reminded them constantly that they needed to be using sign language around me. She said it was mandatory for everyone to sign around me. She was a huge advocate for me and for my language access. And unfortunately, she passed away when I was very young. I was only a little bit older than when we took this photo that she passed away. But she gave me hope. I was able to hold on to those memories and know that there are good people in the world and that I could make it through the challenges I faced. So if someone is having struggles like that, just having that one person can help you hold on to hope and keep going through all those years. And she was my one person. In this photo, I'm in the front with glasses. This was a deaf camp that I went to every year. So I had my hearing family where I was very isolated. I had some access, and then I had access to school. And then before I went to deaf school, I also had access at these camps for deaf children. But that was only during the summer, and it was only once a year. My memories of growing up are feeling very isolated, very lonely, with a little bit of sign language and a little bit of good, positive relationships here and there. But that was enough for me to continue. Now, I'll talk about middle school and high school. Around that time, I started going to the deaf residential school. But during that time, I felt very disconnected from my father. And my brother and I were also separated because I was in high school, he was in middle school. We went to a big school, so I had a hard time finding my identity. I felt like I didn't fit in because I used more signed English. ASL was totally new to me. So there were a lot of big changes during this time, and I often felt very overwhelmed. I was also depressed and anxious. I was emo, I dyed my hair black, I painted my nails black, and I felt like I was very different from everyone else. When I went home, I had hearing parents who did use some sign language, but they weren't culturally deaf like I am. And then in school, I felt like I still didn't fit in because I have hearing parents. So I felt very much stuck in the middle. I didn't really know where I fit in, and I didn't feel like I fit in anywhere. So I had a lot of struggles with my identity during that time. Later on, I'll explain my neurodivergent identity. I won't get too much into that now, but that also adds a layer that I had no idea about at the time. Because I'm deaf, because I came from a hearing family, and also because I'm neurodivergent, but I had no idea about that at the time. But I know now that that contributed to a lot of the struggles that I faced. I didn't have access to therapy. My parents divorced and I was told to go to therapy, but I refused to open up to a stranger about my problems. And I didn't like the idea of going to a therapist at all. So whenever I was forced to go to therapy sessions, I would just spend the entire hour not speaking. My dad would get so mad at me because he paid $300 for me to be there, but I refused to share anything about myself with a therapist during those times. So all of this obviously was before I became a psychologist. But that experience with not liking therapy and having that resistance to therapy made me very angry with the system. I was angry at how therapy approached me. For example, one time I was refusing to talk to my therapist, and then I ended up sharing a little bit about how my parents had been fighting, and the therapist laughed at me. I wasn't sure if they misunderstood me, they were hearing but knew sign language, but at that point I was done. I decided never again would I share with a therapist. And I was very angry with therapy for a long time after that. But just wait. So this is during high school. Remember, I feel like I didn't fit in. My family life wasn't good. I was at a deaf school, but I didn't feel like I fit in. And I didn't really have any healthy role models in my life. I fell in with the wrong group of people, and I ended up getting in a really bad car accident. I was not the one driving, someone else was driving, but I was a passenger in a horrific car accident. And that really woke me up. I had been struggling with school, with friends, with family, but I realized that all of that was really insignificant. My life almost ended during that car accident at 16 years old. That really made me realize that I have big dreams. There's a whole world out there for me. And so my life until that point, I shouldn't let that hold me back. I felt like I had a second chance and I had to take advantage of it. That was really a wake-up call for me. Now, my sign name on my cheek is because I got a scar from this accident, and you can actually see it in the second photo, the injury that I got in that accident. Some people ask me what my sign name was before that, and it's just the letter T on my chest, which is a very hearing English style of sign name. So yes, my identity did change after my car accident because I realized how important life was, and I didn't care about all those little things. My life was more important than that. So I ended up skipping my senior year of high school and going into college at 17 years old. I was very young when I started college. In these pictures, I look like I was very happy, but really I was suffering. I still had to go to my mother's house every other weekend, and I did not want to. I had to look happy, but really on the inside I felt like I was drowning. This is my senior picture on the bottom, and people always say that I look so bright and happy, but I didn't feel that way about myself at all. My life was really headed down a bad path because I did not have the support I needed. There were so many changes and I didn't know how to control any of it, and I didn't have anyone to talk to. My grandmother had passed away. I had my father, but he didn't understand deaf culture. And so it was very difficult for me during that time. Now for college. Remember, I had the car accident, I skipped senior year, so I went to college at 17, and I first went to Gallaudet University. I had a full scholarship, so that's where I was able to afford to go. I was there for a year, and I enjoyed it. I had more exposure to the deaf community, more diverse people, more people with shared experiences like me. Where my education before then had been pretty limited, I had a whole new world of people. And I was able to explore a lot of different options in my life. Here, I shave my head. Now, this is a funny story. I am not one to follow a trend, but the tradition at Gallaudet is for all freshmen to first dye their hair, do crazy things with their hair like mohawks around February, and then at the end of February, I think, everyone shaves their head for bald day. And I was very resistant to that idea. I didn't want to follow the crowd. I wanted to be different. But then with just 1 week left before bald day, my friend said, "Come on, you only live once." And I thought about it. I looked back at the car accident that I had had, and that's true. I knew that. I do only live once. That is a real thing. And so that quote, "you only live once," really got in my head. And I ended up joining the bandwagon and shaving my head bald for bald day. And I have no regrets about it. I also joined track in college, which I really enjoyed. That gave me a sense of purpose. I was able to meet new people. And it really didn't matter what my upbringing had been like. I felt like it was able to open more doors for me. Where I had been stuck in this environment, I felt much more free to explore myself in college. I also took honors classes at Gallaudet. And I'm very grateful for one of my professors in particular. Remember, I didn't have a good family. I didn't have good adult role models in my life. But I had one professor who really believed in me and who was one of the people who helped me find my way. So this professor at Gallaudet at one point asked me for a meeting. I sat down with them. They said that I'm a great student. I've been doing really, really well. And that they suggest that I go somewhere else, that Gallaudet wasn't the right place for me. That really took me aback. My parents never told me that. My school guidance counselor never told me that. I had only been at Gallaudet for 1 semester, but no one had told me that so far. But that felt important, that I had more to offer the world. So I decided to listen. I decided to leave Gallaudet, leave home, and move to Rochester. I majored in psychology because my whole life growing up, I had wanted to understand and provide people with the opportunity to have a better life. And that's what I wanted for myself too. So that's why I chose psychology, is because of my life experiences. I also double majored in pre-med because, again, my father is a medical provider, so I thought there would be some overlap there. And I minored in criminal justice because I already knew that the system is not fair, it's not just. I wanted to change the world, and I was still very angry at this time. So I wanted to change the world. I wanted to change everything. But again, at that time, I didn't realize that I was still going through a lot of unpacking. I still had a lot of unpacking to do and a lot of self-reflection to do. I had social issues at the time because I also still didn't know I was neurodivergent. And coming from a hearing family, I thought that's just the reason why I had a hard time socializing with people. I thought maybe it's because I grew up in an abusive home. I thought there were lots of other reasons for it, but I hadn't yet realized myself that I was neurodivergent. I also had issues with access services. At Gallaudet, I was able to have direct communication with professors and I had no problem. But then at RIT, I would take pre-med classes, for example, and the interpreters would sign in signed English, and I had a hard time understanding them. I had to do a lot of catch up with the textbook. I had to go to tutoring. I didn't yet realize that my brain really does work differently, and I struggled with learning during this time. So I felt like my life had shifted into this new world, but I still had a lot of frustrations and barriers. So RIT is where I fell in love with psychology, but it wasn't until my internship or co-op that I went to the University of Michigan first, and I did a research project on rats. These were rats who they were exposed to meth, and then they were measuring how they responded to different stimuli. I realized that was not what I wanted to do. That was not for me. So I did another co-op at the University of Rochester Deaf Wellness Center, DWC, where all of the providers are deaf. I got to see group therapy, individual therapy, and I absolutely fell in love with it. I knew that's the world I wanted to be in. Those were the people that I wish I had had in my life. They were amazing. It felt like they were magic. They were actually able to change their patients' lives by getting the right kind of treatment. And I knew for sure that I wanted to be that person. That was really the beginning of my journey as a psychologist. Now, I mentioned I was lonely, my family was a mess, so I decided at this time to adopt a dog, Baby Boo. And this was my first time feeling really safe and stable, creating a routine for myself, and experiencing unconditional love. So my parents had divorced, my father remarried, and I actually have a funny story about that. So this woman in the photo with me, after I shaved my head for bald day, it was spring break and my father picked me up to bring me home. It might have been Thanksgiving break, but it was a break from school. And he told me he wanted me to meet someone new. And I thought, no, I don't want to. I don't want another mom. I don't want to. I refused. And my dad begged me. He said, please, just for a minute or two, just say hi to her. So I thought, okay, fine. I will literally just say hi and then get back in the car. So we walked up to the door. The woman who answered the door had very, very short hair after my dad had already yelled at me for shaving my head for bald day. And I thought, how hypocritical. So I was upset. I immediately just got back in the car and fell asleep. And I didn't wake up until we were home. But my dad told me that she had said that I should bring you home because there was no rush, that you could take your time, and that his daughter was the most important thing to him, and she recognized that. That was one of the first times that my father really advocated for me, and that my stepmom, his second wife, also advocated for me. And that was a moment of feeling very accepted and supported by both of them. All right, any questions so far? No? Okay. So now I'll talk about graduate school. I graduated from RIT and I went into Gallaudet's PhD program. The PhD program was both a master's and a PhD. So if you didn't already have a master's degree, you could take classes to get credits for your master's degree and then also get your PhD. So it was a nice combined program. I decided to go back to Gallaudet because I wanted to be in a signing environment. As a psychologist, I knew that I wanted to learn how to treat deaf patients and the deaf community, and I thought it would make the most sense for me to go to Gallaudet. And their program for clinical psychology is very, very good. Now, after I started at Gallaudet, I remember in my very first week, the professors warned us that in this program, as we progress through, we would change ourselves as people. We would have to do a lot of self-analysis, a lot of unpacking, and that we would not be the same after this program. Now, remember, for me growing up in my childhood, I had really suppressed a lot of that, but this was the time. I wasn't going to be able to do that anymore. This program truly did challenge me. And I also learned a lot. So I used to email my professors very bluntly and just ask, hey, why did I get this grade? Or things along those lines. And one of my professors sat me down and explained that I needed to have good email etiquette. I needed to say, dear so-and-so, and sign off on my emails. That I needed to learn how to communicate more appropriately. That is also when I finally started therapy. I had a group therapy class, and the class teaches group therapy, but the professor also warned us that if we had not yet had personal therapy, the time to start was now. Because as providers, we also needed to know what it's like to be a client. And I knew in my heart that it was time. So with thinking about all of that, I started therapy, and for years and years and years, I started working on my trauma. I found out that I had ADHD, we started treating that, and then I realized that there was still something different. And that's when I found out I was on the spectrum. Looking back, I thought, no wonder I had a hard time fitting in. No wonder I had a hard time socializing. No wonder all of these different experiences that I'd had. And it wasn't until I got into graduate school that I found that out about myself. That was very powerful. It was really a life-changing thing for me. And that would not have happened if not for my professors, who became my mentors. I'll talk more about this later, but I knew I wanted to go to grad school. I wanted to be a psychologist. I still wanted to change the world. I hadn't forgotten about all of those systems that I was fighting against too. So here you can see that my face has a lot of acne and spots on it, and that's because I was picking at my face because of anxiety. That was before I realized that I was on the spectrum. After therapy, I found out I was on the spectrum. I found out that that was a stimming behavior. And so now I don't even wear makeup anymore. I don't wear any makeup because I know who I am. I know how my brain works. I have skills and strategies and fidget toys and coping mechanisms that I can use instead. So if I had never started therapy, if I didn't have the type of professor who told us that we had to do that, I would have never had that opportunity to discover these things about myself and to get therapy that really helped me deal with it. That really helped me see what a life-changing experience that can be, and that affected how I provide therapy for my clients as a psychologist now. I also got pregnant. This is my second child right now. And my first pregnancy was unplanned. But my program was very, very supportive of me throughout. At that time, I was a single mother. That was also right before the COVID pandemic started, so that delayed things for me. We had to wear masks for the last part of the program. It was difficult for me to follow language around me in communication because of the masks. But that taught me resilience, and that taught me how to navigate problems and challenges, and how to hold on to my vision. That helped me develop a sense of purpose. It wasn't necessarily just a bad experience, but it helped me learn how to handle adversity. Those experiences helped me better understand how to navigate that for myself and how to teach my clients how to navigate these challenges. So despite all of this, I did graduate. I had a great relationship with my cohort. And all of my personal challenges were not barriers to me, but opportunities for me to become a better person and a better psychologist and a better person who can relate to others. So, with my personal journey, now I'll talk more about my career and my professional journey. I've worked in hospitals, I've worked in colleges and universities and counseling centers in many different settings. At the beginning, I worked at Gallaudet's Counseling Center, which was pretty easy. I had direct communication, everyone used sign language. And my professor told me that I needed to look for an internship outside of Gallaudet. Because it was an accredited program, it was very competitive for us to find internships outside of Gallaudet. And if I didn't have experience working with hearing clients, I wouldn't be able to find a job in the future. So to make myself more competitive, they told me that I needed to have an internship in a hearing setting. I didn't really want to, but they pushed me to do it and pushed me outside of my comfort zone. Now, I got to have some experience treating people who don't use English, people who use Spanish, Portuguese, who are court-ordered to receive therapy. So I had an interpreter for myself, and then sometimes also had an interpreter for the spoken language that the client used, which was pretty cool. It wasn't just me with an interpreter, but the client had an interpreter too. So that was an interesting experience for me. This was only during the summer, so it was fairly short, but I got to meet new people, different states, different perspectives. One lesson that I learned from these places is that when I'm in the room with a client, I feel what they're feeling. I feel the energy in the room, and I need to listen to that, which was a different approach for me. I also had a great deaf mentor. It was a good opportunity for me to have deaf mentorship. But again, I was really pushed to work with hearing clients, and so because of that, I ended up working at a short-term hospital in DC, St. Elizabeth's. And when I first interviewed, they asked me how I would protect myself and how I would pay attention to clients because I couldn't hear, because it was sometimes a dangerous area to work. They had some doubts, but I was confident that I could work with my interpreter. And so I started my internship with an interpreter. Now, 99% of people were very accepting of me. Only 1% had some reservations because I was deaf. But because I am deaf and open about being disabled, some clients were also more open with me. They saw that I was being vulnerable, and so they were vulnerable in response. I didn't expect that at first. Some clients also told me that they are hard of hearing, but that they haven't disclosed that to their other providers. So me being disabled and deaf helped other disabled people disclose those identities to me. I thought that my deafness would be a barrier, but it was actually a very positive thing. And it really opened up a world of possibilities for me. That really helped me become more confident too. I also had good mentors and good supervisors. So my supervisor would tell me if an interpreter didn't have an interpretation that matched my personality. And so that happened sometimes, and clients would get confused by that. So they helped me work with interpreters who could really match my personality. It was a very rich experience for me. So again, there was that accredited internship, and I ended up working at a high security hospital with a forensic population. There were concerns about me being deaf, there were safety concerns, but what I said is what's most important is having a consistent interpreter who I can work very closely in partnership with, and not having different interpreters every day. At first, they refused to provide an interpreter who would be consistent. They wanted to assign their own staff interpreters. Where in my internship, I had group supervision, we talked about systemic issues, we talked about hospital systems, we talked about some of the frustrations that we've had with the systems, and I knew at that time that I didn't want to have different interpreters, and I didn't want to have a staff interpreter from the hospital. I had my regular interpreters from Gallaudet who I wanted to use. And the hospital was resistant. They said it would have to be Gallaudet then who paid for all of the interpreters. And we spent really half of my internship time arguing about who would pay for interpreters. And reducing me to the cost of interpreters felt really gross to me. What they ended up doing was splitting the cost 50-50 between the hospital and Gallaudet, but I did get to have a consistent, familiar interpreter the whole time. I did have that opportunity to advocate for myself, and I had other people advocating for me too, but it wasn't an easy process. That taught me that my disability can be a positive thing too. I had one client at St. Elizabeth's who I remember, and I remember talking with my supervisor at the beginning about my assignments. They said that they would assign me to a diverse pool of different clients. There was one person in particular who had come into the hospital at 19 years old and was now in his 40s. And his longest time attending therapy was 3 months. He was in a wheelchair. He would often urinate and defecate and throw it at people. And so the supervisor was hesitant about assigning him to me, but I said that would be fine. Remember, for me growing up, I don't judge people. I don't just write people off. And I don't want to just push people under the rug because they're too difficult. I really wanted to work with this population and wanted to work with each of these individuals. So the time came that I met with this person. I had my interpreter with me and I saw him wheeling up to me. I introduced myself and he said, I actually speak other languages too, and it's so cool that you use sign language. And that was it. That was an instant connection. He was very interested by different languages, and being an ASL user, he was fascinated by that. We ended up working together for the full 9 months, and other people at the hospital were shocked by that. Either they didn't want to work with him or they didn't think that he was worth treating, but he's a human. And so there are all these masks that he has of not grooming himself, not taking care of himself. But in the end of the day, he is human. He's a person. So after 9 months of therapy, when I had about a month left in my internship, I got to work and everyone told me right away that I needed to see him. And had I seen him yet? They told me he had actually shaved. He had cut his hair and he was walking. He went to go see a doctor. I thought, okay, all right. And then I finally met him, and he actually was walking. He was clean shaven, he had cut his hair, and he was laughing. So that simple act of me seeing him as a person and connecting with him as a person was powerful. For so many years, he had avoided therapy, and people had avoided him because he was scary, he was schizophrenic, whatever else. But me seeing him as human and deserving treatment made that connection and showed me that I can help people. I didn't always have people in my life who could provide that for me, so I wanted to be the person now to be able to provide that to other people. That was a very powerful lesson for me. With all of these systemic issues, dealing with interpreter costs, people questioning my abilities because I'm deaf, despite all of that, I was still able to provide therapy and help for other people. Now, the system is not perfect, but it is worth fighting and advocating for yourself. So, I graduated with my graduate degree, and I did a postdoc. So, after getting my PhD, I still needed some number of hours to become licensed. Gallaudet had recently established a new center called the Deaf and Hard of Hearing Childhood Resilience and Recovery Center, where they focused on deaf and hard of hearing children who have experienced trauma. There was also the Gallaudet Counseling and Psychological Services Center, which provided services for the general community. What was great about Deaf and Hard of Hearing Childhood Resilience Center is that I got to do more work with experiment and assessment, translation, and adaptation for deaf and hard of hearing children. So many of those assessments are in English, intended for hearing people. Some studies have looked into adapting those materials for deaf and hard of hearing populations. This is around the same time that I became more interested in interpreting. So in that process of translating and adapting the materials, sometimes I would ask the interpreter or I would ask other people how to best translate something, and they often didn't know. They didn't know the best way to administer these tests for deaf and hard of hearing people. And that also told me when I was a child growing up, I was given some of these assessments, and those people really didn't know what they were doing. I suffered that because of my family and because the system was not designed for me as a deaf person. So doing that research on how to adapt and translate these materials helped me gain valuable assessment skills and made me more interested in interpreting. After that, I worked at the Learning Center for the Deaf. That's in Massachusetts. And I enjoyed my time there. I became a clinical director. I worked with deaf and hard of hearing children who have experienced trauma. And what was interesting is even though I was working in a deaf environment, I had a hard time getting interpreters. I had to call hospitals, I had to call families, I had to call child protection services, and I was not able to get an interpreter for those. I was told to just use a video phone. Because it was a deaf school, I thought it would be accessible for me, but it ended up not being accessible. And the video phone was not an effective way to make those phone calls. So I had to figure out how to navigate that as a provider in a different way. I also realized that it was time for me to get licensed, and that would allow me to provide independent services. The first part of licensure for psychologists, now it's different in every state in the United States, but standard is to take a knowledge test first, and then after you pass that, the second test is more about ethics. The ethics portion of the exam is intentionally has bias baked into it and is intentionally vague. That test also has videos of people speaking, so I asked the testing company if they could add captions to make it accessible, and they refused. So this is a mental health field denying captions for a deaf psychologist. I tried to fight that, and they just refused. So my options were either to take the test or to give up. I took the test and I failed by only a few points, but they were not flexible at all about adding captions. So I had already gotten all of this experience, I had a job, and yet still I was facing more frustrations. When I moved to Massachusetts, I realized that I could take a different licensure test. The test in Massachusetts focused on legal mandates and legal reporting requirements. I took that and I immediately passed, easily, because there was less bias in the exam. So the exam varied state to state, and I discovered there that some states were more accessible than others. But again, that's an example of where I was pushing the boundaries and figuring out a way to make it happen despite those frustrations. I decided to, as an independent licensed psychologist, set up a private practice so that I could treat deaf and hard of hearing people who had experienced trauma in a trauma-informed environment. There was one organization called Advocacy. I worked there briefly, and they were wonderful. They primarily supported hearing clients, but I was able to work there. I became clinical director, and they were a very cool organization. They did not actually use the term clients. They only referred to people we support. All of the paperwork, notes, and documentation were also supposed to be in layman's terms, because the notes that we created were not just for ourselves. They should not be full of psychology jargon, but they were for the clients, the people they serve themselves. So again, for me growing up with systems that oppressed me, always feeling like I was inferior, now being in a space where everyone was treated equally and they believed that we were all the same, that was a great system. And then the system wasn't the problem anymore. We were all working together to fight that larger system together. I had felt alone for so long in having that burden of fighting those battles, but now I felt like I was in an environment with people who cared and who wanted to support each other and support me. So fighting the system, fighting for access, proving myself with limited support, finally helped me find my niche. And that's where I am now. I have also realized that advocacy work never ends. It's a constant fight. Having interpreters alone does not guarantee equal access. Access is for everybody. Deaf providers should be considered equal to hearing providers. Interpreters also need specialized training in mental health, which many are not. Licensure and licensure exams need to be accessible. Education needs to be accessible. There is such a long list of work that we still need to do. I also became a deaf interpreter because, like I said, I was interested in how interpreters work and how we can train interpreters to be more accessible for future deaf providers. I felt like I had a lot of that burden to fight against the system, but I want to give back to future generations and open those doors for future deaf providers to have an easier time. So, for example, I became clinical director for hearing clients because that organization, Advocates, had already had deaf people working with them before, so that door was easier for me to open. And now I want to open those doors and be that person for deaf people in the future. The mental health field is very hard, and the systems do oppress people, especially people who are disabled and come from marginalized backgrounds. For me, as a person, as a survivor, I have a moral obligation to speak up when I see something wrong. If the system is oppressing people, I want to fight against that. I view my job as my obligation as a human being. And I give back to the community by creating a private practice, by giving presentations like this, by training interpreters, by providing consulting services. I want to serve the community more broadly. I do have a private practice, lifestyle and access, and then Terp Academy is where I teach interpreters specialized mental health training to be able to provide better interpreting services in those areas. And I originally connected with them completely by chance. There was one interpreter in Florida. Now, I was in Florida during the COVID pandemic, so many interpreters didn't want to work in person. But I worked with one interpreter who encouraged me to train other interpreters because there's so little mental health training available. So I connected with that agency, and then ever since then, I've worked in partnership with them to provide training opportunities for interpreters during the summer. So my final message is when you see a barrier, don't run away from it, don't get stuck by it, don't give up, but see that barrier as a door that has a key. You can find the key to open that door. You can overcome any challenge. You can find ways to navigate through or around challenges, and you can partner with other people. Don't let barriers stop you because barriers show you the way through. It will not be easy. It won't. But you will feel so accomplished when you can break down those barriers and make it easier for future generations. The barriers that you face will teach you a lot. In grad school, I learned how to give therapy. I learned how to do all of these technical skills. I didn't know how to advocate for myself. I didn't know how to change the system. I didn't know all of these things, but I learned that from overcoming those obstacles I faced. And rather than saying, no, I didn't do that, or no, I can't do that, I just tried again and again and again and again. And sometimes I had to go to different places. I had to find different people who would support me and who shared the same values as me to help me overcome those obstacles. So this quote is very powerful. Every barrier is a step. Rather than just going somewhere else, choosing a different career, doing something differently, I decided to overcome each obstacle. And each obstacle ended up as being a step in the staircase for me to reach my goal. So my advice to you is don't be scared of those barriers. Yes, it is hard, but you can get through it. Those barriers are meant to be broken. keep that care. You do have power and privilege, and you can use it. For example, for me, as a deaf person, maybe I don't have privilege, but I do have privilege of English literacy and research skills. I do have privilege of the ADA, and I have privilege in other ways. So that improves my ability to break down barriers. So use whatever privilege you have. And disability can be an advantage. For example, when I worked with people in the hospitals, that opened doors and allowed us to connect with each other in an easier and better way. So don't think of your disability as a barrier. Think of it as an advantage. And then advocacy. We have the idea that everyone should know how to advocate for themselves, but no, it's a skill that you have to learn. When I was younger, I fought against every single system, and I got angry all the time. And that anger was valid, but it was not effective. People taught me along the way. For example, I had one advisor during graduate school who sat down with me to talk about my advocacy skills. And I said, I just want to change the system. I'm so frustrated with everything. And they said, well, start by asking questions. That seemed so simple, but it's true. Asking questions helps me get the answers of where the barrier is coming from. What kind of barrier is it? What's causing it? And asking questions opens a conversation. It invites collaboration with other people. It doesn't mean that it will be perfect or smooth, but having that communication allows me to better understand where that barrier is coming from and how I can resolve it. So when I worked at the hospital and they refused to pay for interpreters, by asking questions, I was able to find the person who was making that decision and negotiate with them. It's not necessarily the fault of the person who's actually talking to me. That barrier is coming from someone else, and that's the person who I need to talk to. So asking questions opens those conversations. Now, because of time, I would ask you to self-reflect on these questions on your own. Feel free to share during the reception if you'd like, but it's up to you. But think about the barriers that you've faced. It could be a current barrier or one in the past. And what did it teach you? And how could that barrier shape your purpose or become your purpose? My life experiences, the struggles, the trauma that I've faced, all of that, I could have let it overcome me, but instead I overcame it, and it became a sense of purpose for me. And you can do the same thing. You can transform that barrier into purpose too. So think about that on your own. Now, in closing, I want to mention a few things. First is that your path may not be linear. Like me, my goal was to become a psychologist. I had some deviations along the way. There were some places where I got stuck, and your path will probably be the same. What's important is that you stick with it, and you will get there. The next thing is that barriers are not limitations. Barriers can be lessons. Don't forget to advocate for yourselves, because that will let you advocate for others. And when you advocate for others, that will also help you advocate for yourself. And trailblazers take risks. The first person to open a door, the first person to break down a barrier, is taking a risk. People saw me as being difficult to work with. They were annoyed by me. They were frustrated that I was always speaking up. And that was a risk that I took in how people perceive me. But sometimes that comes with the territory. As a trailblazer, you take risks. And the journey may be lonely. It's important that you hold on to those people in your lives, those one or two mentors you meet along the way, and use your resources. But it can be lonely sometimes. All right. If you'd like to reach me afterwards, please feel free to contact me. Here's my contact information. You're welcome to take a picture of the slide if you'd like to.